One of the things I'm most excited about going forward is that we're able to start a sports medicine fellowship. What a fellowship is the extra training that you get to do certain types of medicine. And so for sports medicine in particular, you do a residency, and then once you finish your residency, you're board certified physician, and then you do extra training in a sports medicine fellowship. And so once we built our clinic up and we had the volume and we're doing all the things that we wanted to be able to do, then the logical next step was to start bringing in upcoming doctors to train to do what we do. We see all the patients that they need to be able to see, and so it's really easy then to bring them in and start having them train with us side by side. And it's really like an apprenticeship. They're in here with us side by side, seeing what we see, seeing the patients that we see, and then learning how we do things. And then that's how they then become their own independent individual physicians. And so that starts this year, and we're really excited about it. There's two benefits for us having the fellowship. One is myself, Dr. Parker, Dr. Jordan Engo, all have this desire to teach. It's one of the things that some people either kind of decide they want to do as they come up through their medical training, and other people don't. And we all have that background, and so for us that's one part, just to kind of scratch that itch and to help kind of give something back. The second part is having the extra manpower, to have the extra people there. We can then have more bandwidth to bring in more patients when they need to be seen, to have more hours to be able to see patients because we have more people. And honestly, our limiting step a lot of the times is how many people we have. And so this helps us on that end too. I did my fellowship at the University of Pittsburgh in Pittsburgh, Pennsylvania. And anywhere you train, you carry that with you forever. And I still do things now that I learned from some of the physicians that I worked with there. And I tell that to people. I learned this from such and such doctor. I learned this from this person, and I found that this works better. Because for everything you do, there's more than one way to do it most of the time. And so you have to figure out what works for you. And so that's hopefully down the road, as these fellows come through, they'll say, oh, I learned this from Dr. Bullers. And they'll teach that to somebody else down the road, or at minimum, it becomes useful for them in their practice.